Hello everybody, welcome to my Ed Talk. We're going to talk about sciatic nerve blocks. So what makes up the sciatic nerve? So the sciatic nerve is made up of the lumbosacral trunk, which is the ventral rami of L4 to L5, and it joins together with S1 to S3 from the sacral plexus. So they're going to come and join together and create the sciatic nerve. So for the visual people out there, you see L4, L5, ventral rami, which is basically the lumbosacral trunk, is going to join with the sacral plexus, and it's going to create this wonderful sciatic nerve. Now let's talk about the muscles or compartments that are supplied by the sciatic nerve. So the sciatic nerve innervates the thigh extensors, which is part of the hamstring group, plantar flexors, and the dorsiflexors. So as we can see, it's quite a bit of muscles. Now let's talk about anatomic landmarks for our parasacral sciatic nerve block. So we're going to zoom in just a bit to see it better. So we're going to see we're going to palpate the posterior superior iliac spine, which is right around here, and the ischial tuberosity. And we're going to draw a line straight down the middle of them. And we're going to have our insertion point 2.5 inches below the posterior iliac spine. So you measure about 2.5 inches below here, and that's your insertion site. Now, what about the transgluteal sciatic nerve block? So we already know where the posterior iliac spine and the ischial tuberosity is. What we're also going to do is palpate the greater trochanter, which is over here. And you're going to draw another perpendicular line here, right in the center, and your insertion point is going to be right around here. All right, these are really great blocks, especially for the posterior thigh, knee, and leg. But when would we need to supplement a sciatic nerve block with another peripheral block? So we know that sciatic nerve blocks are great for the posterior thigh, posterior knee, and leg. But unfortunately, it does not do a great job of blocking the anterior and medial thigh. So for anterior and medial thigh procedures, the anterior and medial thigh are innervated by the femoral and obturator nerve, so you're going to have to block those separately. Thanks for watching.